only 20% of Africans have a chance to be vaccinated in 2021. Africa is getting ready for the COVID-19 vaccine. AstraZeneca/Oxford AZD1222 vaccine is rolling out in Africa, the initial 90 million doses, but only 3% of the African population, only 20% of Africa expected to be vaccinated in 2021. WHO puts it out as good news. In reality, Africa seems to get the short stick when it comes to getting the coronavirus vaccine. A spokesperson of the African Tourism Board thinks this is terrible news for the continent and even worse news for the tourism economy this year. Matshidiso Moeti, WHO Regional Director for Africa, highlighted that the deployment is a critical first step to ensure countries' access to vaccines. Africa has watched other regions start COVID-19 vaccination campaigns from the sidelines for too long. This planned rollout is a critical first step to ensuring the continent gets equitable access to vaccines, Dr. Moeti said. The rollout of the AstraZeneca/Oxford AZD1222 vaccine is subject to the vaccine being listed for emergency use by WHO, which is currently reviewing the vaccine, and the outcome is expected soon, according to the agency. Amid surging demand for COVID-19 vaccines, the final shipments will be based on production capacities of vaccine manufacturers and the readiness of countries, WHO added, noting that recipient countries are required to submit finalized national deployment and vaccination plans to receive vaccines from the COVAX facility. The initial 90 million doses will support countries inoculate 3% of the African population most in need of protection, including health workers and other vulnerable groups, in the first half of 2021. As production capacity increases and more vaccines become available, the aim is to vaccinate at least 20% of Africans by providing up to 600 million doses by the end of 2021. Ramp up readiness. Dr. Moeti also said that the announcement allows African nations to fine-tune their planning for COVID-19 immunization campaigns and called on the countries to finalize their immunization plans. We urge African nations to ramp up readiness and finalize their national vaccine deployment plans. Regulatory processes, cold chain systems and distribution plans need to be in place to ensure vaccines are safely expedited from ports of entry to delivery, she added. We can't afford to waste a single dose. Additional doses. To complement COVAX efforts, the African Union has secured 670 million vaccine doses for the continent, which will be distributed in 2021 and 2022 as countries secure adequate financing, according to WHO. In addition, about 320,000 doses of the Pfizer-BioNTech vaccine, which has already received WHO emergency use, have been allocated to 4 African countries: Cabo Verde, Rwanda, South Africa, and Tunisia, which have the capacity to store and distribute doses at -70°C, the agency said. The COVAX facility. The COVAX Global Vaccines Facility is the vaccine pillar of the ACT Accelerator, an initiative launched in April 2020 to speed up development of medicines to treat COVID-19 and make them available to people everywhere. The global initiative is led by WHO, Gavi, the Vaccine Alliance, and the Coalition for Epidemic Preparedness Innovation (CEPI). It works to ensure as many countries as possible cooperate to pool development, procurement and allocation of any COVID-19 vaccines. Source: UN News Center.